So we're talking today about insomnia. Insomnia is a big problem for a lot of people out there. Many people just have trouble falling asleep, staying asleep throughout the night, and this can have a real negative effect on their overall health and well-being. The quicker we can solve it, the better off these people are going to be. A lot of people will actually become dependent on sleep medications, which also becomes a problem, sometimes worse than insomnia itself, because they start to become addicted to these medications, and they'll look for stronger and stronger medications to go to sleep, and sometimes, unfortunately, go to alcohol and other type of recreational drugs that can obviously have a negative effect. I've worked with hundreds of patients with insomnia, and we've found there's 4 main categories of insomnia that we work with. Number one, the person cannot simply fall asleep. Simply their mind might be racing too much, or they've got too much on their brain they can't stop thinking about. Number 2 is they'll sleep for a little bit, but then they'll wake up frequently throughout the night. 1 or 2 hours they'll sleep and then wake up, and this pattern will continue throughout the night. Third category is the person will sleep for 4 or 5 hours and then wake up and can't go back to sleep. And then lastly, we have a restless legs issue where people's legs are kicking throughout the night. This may be associated with night sweats, and they simply can't get back to sleep. A lot of times, one of the first things I recommend is for the patient to have a very dark room. Create a very dark environment, like a sleep chamber, I like to call it, where there's no light, no outside light coming in at all. Even the LCD lights on your stereo or your TV, whatever, all those things should be removed. So the room's as dark as possible. It should be cool as possible without any noise. As much as you might be loving a pet lover, if you have pets, it's a good idea not to have pets in the room. You want to make this a sleep chamber. Your bedroom is for sleeping. It's the most important time of your night, and that's you want to sleep properly. So those are the one things we recommend starting off right off the bat. Before you do anything else, do those things. Secondly, we will start into restoring the natural hormones that are necessary for sleep. And there's 3 critical hormones that must be there for your brain to sleep properly. Number 1 is melatonin, that's your primary sleep hormone. Number 2 is serotonin, that's your rest and regeneration hormone. And number 3 is GABA, that's your actual relaxation hormone. So the products that we formulated are designed to restore those 3 primary brain chemicals so that your brain can sleep and you can sleep throughout the night properly. So the actual formulation for AhSleep that makes it so effective is melatonin, which is the primary chemical that helps to induce sleep for the brain. Most people with insomnia are lacking in this important chemical. Also, it contains phenibut, which is a GABA-like substance, and GABA is the actual chemical that induces relaxation throughout the brain. So the phenibut that we use is designed to increase this effect, enhance this effect over what normal GABA would do. It also contains theanine, which is another relaxation chemical for the brain, and passion flower, which is also a relaxation chemical for the brain. So these ingredients are designed specifically to help induce sleep, but also to help slow the brain down, allow the brain to relax so it's not racing all over the place, which is what so many people have problems with insomnia.